Yeah?
Mr. Tapscott,
Yes, Miss Giannis.
I don't know if we heard from Trang.
We didn't.
Ling.
We didn't hear from her. I'm so sorry, Miss Nguyen. Are you there?
Oh yeah, I'm here.
Miss Nguyen, I'm so sorry.
I know, but I think in the so many people have in the question. I want to listen that.
Well, you're very kind, but you're very important. And honestly, I'd much rather hear from you than listen to myself talk more. What are you grateful for today?
I get for everybody in the class and the happy day today.
Good. It's a happy day today. You're grateful for everybody in the class.
Yeah. Thank you, Madam. I tried to the lesson before that he forget me.
Yes, I'm sorry.
No. I want to everybody in the share and listen that. I like that.
Yeah. Well, that's very sweet of you. But I do appreciate Miss Gianna's pointing out that there is a 14th member in the class that I'd forgotten about. Yes. By the way, I didn't really forget about you. I just checked people off a list and get lost in all the stuff we're talking about. All right, so you're very sweetly grateful for everybody here, the conversation you heard, and it's a very good day. Anything else?
Yeah.
Anything else, Miss Nguyen?
Yeah.
That's it?
Yeah.
Okay, thank you. Thank you. Okay, let's see. All right, there's no slide presentation, right? So you might just want to pin me to your screen instead. See if we can kind of do this a little bit. Yeah, that'll kind of work, I think, pretty much. Okay. Miss Giannis. Miss Giannis. Let's review what was Bones. Bones, you told me that Bones were your favorite and that you wanted to review them. Yeah. Okay. Miss Giannis, let's do some real simple stuff here. Okay. Okay. What region of the body is this?
The cervical.
Cervical. So this is the cervical region here. How many cervical vertebrae do you have?
7.
Good. And what's the first cervical vertebrae called?
C1 or the atlas.
Yes, C1 or the atlas. Guy holding the world up on his shoulders. Excellent. What is the next one called?
C2 or axis.
Yes. And what is the last cervical vertebrae called?
Vertebral prominence.
Yeah, vertebral prominence or C7. Very good. Good job. And what's the next vertebrae after that called?
T1.
T1, that's it. I just want to make sure you understood, right? We go 1 through 7 and then 1 through... How many T's are there?
12.
Yes, there are. 1, 2. What makes them thoracic vertebrae? Like, why are they thoracic vertebrae? Just because I decided to put a T in front of them?
I don't know, is it just because that's where they're located?
No. Hold on, I'm going to give you a clue.
Is it because they attach
Say it.
the chest to the body, the ribs?
Yeah. Anything associated with a rib is a thoracic area. So, any vertebrae associated with a rib is a thoracic vertebrae. Any area with a rib is the thoracic area. This is your thorax, anything. Good, cool. So that's what makes them thoracic. What's the last thoracic vertebrae?
T12.
Yes. What's the next vertebrae after that?
L1.
How many L's are there?
5.
Yep. Good. 5. Cool. What is the bone that comes after L5?
The sacrum.
Cool. Cool, cool, cool. What is the joint between the last lumbar vertebrae and the sacrum called? Don't overthink it.
Thoracic sacral joint.
I like that. Actually, that was good. L5S1 is the joint between the last lumbar vertebrae and the sacrum. Sacrum is referred to as S1, believe it or not, everybody. It used to be multiple S's that fused together, but the only reason I mention L5S1 is it's a very common area for herniations of the disc in there. You also hear L4, L5, right? Those last couple of vertebrae is where a lot of pressure comes. Anyway, okay, cool. You've got hips coming off here. What is the joint between the sacrum and the hips called?
Sacroiliac joint.
Yes. Why is Tapscott obsessed with the sacroiliac joint? Can you tell me anything about it that's interesting or whatever? I don't know.
Is it because it's what holds up your whole upper body?
Yes. The entire upper body attaches to the entire lower body through that joint. Right? This, Miss Monreal, this is the joint that drives her nuts. We think because she's a little bit torqued, actually. And so she's got a lot of pressure on one of her SI joints. Okay. How many bones make up the hips?
3.
Yeah. What's the top one called? The one that is kind of our hips. We think about it, you know?
The iliac.
Yeah, ilium. And that's the iliac crest, but you're absolutely right, ilium. What's the one in front here that I can touch right down here?
The pubis.
Yep. And what's the one back here that's kind of at the bottom of my bottom fold that I sit on?
The ischium.
Ischium. Thank you very much. Cool. Okay. What is my thigh bone called?
Oh no.
Like this, the biggest bone of my body.
Femur.
Femur. Did we just talk about this yesterday? What is my kneecap called?
Patella.
Good. What is my shin bone, my medial shin bone, the bigger one, called in my leg?
That's your tibia.
Tibia. And what is my lateral smaller shin bone called? Leg bone.
Fibula.
Fibula. The tibia rests on a foot bone. What's it called?
Talus.
Yes! Cool. All right, we'll come back to feet later. That was really good. Thank you, Ms. Giannis, for kind of warming us up. I will be back to you many, many, many more times. I just want to promise you that. Miss Felix Osuna. Hello.
Hi.
Hi, we can hear you. So let me ask you a couple questions. All right. What region of the body is this?
That's the cervical.
That is the cervical region. How many cervical vertebrae do you have?
There's 7.
7. What's the first one called?
Atlas.
Atlas, yeah. What's the second one called? Yeah. What's the last one called? C7.
What was the question? You cut off the-
Sorry. What's the last vertebrae C7 called?
Oh, that's the vertebrae prominence.
Yes, vertebral prominence. Thank you. After C7, what vertebrae comes next?
Thoracic.
Yeah. Thoracic what?
Region.
I'm so sorry, what?
Sacral region.
Yeah, but what's the name of the first thoracic vertebrae?
T1.
T1, thank you. To T12, good. That's what I'm looking for. Thank you, ma'am. After T12, what vertebrae comes then?
the lumbar?
Yes.
Oh.
Good. Say it.
L1.
L1. Thank you. And what's the last lumbar vertebrae? I think maybe you're just cutting out. Yes, L5. What comes after L5? What bone comes after L5?
That's the sacrum.
Yes, good. The sacrum is attached to your hips. How many bones make up your hips? How many bones make up your hips?
That's the iliac, ischium, and pubis.
Yeah, ilium, ischium, and pubis. Cool, cool, cool. I'll take that. What is the joint between the sacrum and your hips called?
It's the sacroiliac.
Yeah. I haven't asked anybody this yet, so if you don't know this, don't worry. Do you know what the joint is in front where your two pubic bones meet? Do you know what this joint is called where your two pubic bones meet? I'm pushing on, I know this is weird, but I'm pushing on it right now. It's above your reproductive organs. It's where the two pubic bones meet.
Could it be pubic iliac?
That was not bad, actually. It's called the pubic symphysis. It's the symphony where these two things play together. Pubic symphysis, everybody. Pubic symphysis. Cool, cool, cool. I love it. All right. What is your thigh bone called? This large thigh bone here.
Femur.
Yeah. The femur. What's your kneecap called?
Patella.
Yeah. What's your big, thick medial shin bone called?
Tibia.
Yeah. What's your skinny lateral leg bone called?
That's the fibula.
Yeah, fibula. The tibia rests on a bone, a foot bone. What's the foot bone it rests on?
The talus?
The talus, yeah. And then underneath that's the calcaneus and the tarsals and all that other stuff. We'll get to that in a minute. Cool, cool, cool. Last questions, madam. What bone is this?
That's the humerus.
Humerus. And then I've got two forearm bones. Don't worry, I haven't asked anybody this yet, so you can mess this up if you want. One forearm bone goes to the thumb. What's that called?
Is that the ulnar?
No, that's the one that goes to the pinky.
Okay, that's
Yep.
the radius.
The radius goes to the thumb, always. And we have to say that, by the way, because right here, this is my radius, but guess what?
Mm-hmm.
Now it's my ulna. My radius just dropped down here because they can actually cross over each other. So anyway, the radius goes to the thumb. Thank you, well done. Thank you, ma'am.
Thank you.
Cool, cool, cool. All right. Miss Moore.
Yes.
Hi, Miss Moore.
Hi.
Hi, Miss Moore. What region of my body is this?
The cervical.
Cervical region. How many cervical vertebrae do I have?
5. Wait, 7.
Which one is it?
7.
All right, we'll take 7. What is the first cervical vertebrae called?
C1.
C1. And what's the name for C1?
Cervical vertebra.
You're absolutely right, by the way.
Wait.
It is C1. It is cervical vertebrae 1. That is correct. But we also give it a name for the guy holding up the world.
Oh, Alice?
Yeah! So what's the next cervical vertebrae called?
Thoracic. No, wait. The next cervical, C2?
Yeah! And what's its name?
Oh my god. It's just there.
First one's Atlas, right? You told me that one. What's the next one?
Wait, I'm supposed to see Atlas and Axis?
Axis, that's right.
Yeah.
Atlas and Axis is C2.
Mm-hmm.
What is C7 called?
Is that the no, wait. C7.
It has a name. Call it vertebra something.
lumbar vertebrae. Is that one?
No.
Uh-huh.
No.
Wait.
No.
Oh.
No. It's called vertebra prominence.
Oh.
So- So after C7, what's the next vertebrae?
After.
Yep. If you go more inferior, what comes after C7?
Is it T1?
It is T1. Good. And T1 runs all the way down to T what? What's the last T?
T12?
Yes. And after T12, what comes?
L1?
Yes. And what's the last L?
L5?
Yes. You're on a roll, ma'am. What comes after L5?
The pubic, wait. After
It's a bone,
L5,
yeah, what comes-
Is it the pubic, bone?
Not really. L5 sits on what bone? What triangular bone?
The sacrum?
Yes. The sacrum. The sacrum, yeah. Now, the sacrum connects to your hips. How many bones make up each of your hips?
3.
Yes. What are their names?
The iliac.
Yep. Ilium?
Yeah, ilium. The, coccyx.
No.
And, no?
Ilium? Coccyx is the little tail coming off your sacrum. Literally.
So the sacrum.
Well, no. So the ilium,
Mm-hmm.
and then two more.
The pubic.
Yes. Ilium,
And
pubis.
Pubic and. Oh my god, it's right there. Where?
It's hard. This is hard.
It's not coming to me.
Ischium.
It.
Ischium.
I knew that.
Ischium is in your tuschium. Yeah, ischium. Cool. Okay. What is your big thigh bone called?
The femur.
Yeah. What's your kneecap called?
The patella.
Yeah. What's your big, thick, medial shin bone called?
The tibia.
Yeah. What's your lateral, thin leg bone called?
The fibula.
Yes. Your tibia rests on a bone when it connects to your foot. What is the bone the tibia rests on in your ankle there?
The talus.
Good job. 3 more questions.
Okay.
What is this arm bone called here? Brachial bone called?
The humerus.
Yeah, humerus.
Yeah.
What is the bone running to your thumb here called in your forearm?
The radius.
Yes. What's the bone here that's running to your pinky and your elbow here called?
The ulna.
Ulna. Yeah.
Ulna.
Ma'am, you did very well. Thank you very much. It's been a pleasure talking to you. Yes. Miss Melodic. Hello. Miss Melodic, what region of my body is this?
The cervical,
How many cervical vertebrae do I have?
7,
Good. How many thoracic vertebrae do I have?
12,
Yes. How many lumbar vertebrae do I have?
5,
Yes. Underneath my L5, my last lumbar vertebrae, what's the bone underneath there?
the sacrum,
Yes. The sacrum is connected to my hips via a joint. What's that joint called? It connects my sacrum to my hips.
that's the one thing I didn't write down.
Sorry.
No.
I'm laughing at your pain.
Well, I know the 3 bones are the ilium, the pubis, and the ischium, but I don't know the joint, I'm gonna be honest.
Okay, well, you have done so well at knowing those 3 bones that what if it's where the sacrum meets the ilium? So what might you...
Sacroiliacus joint?
Sacroiliac joint.
Okay.
You have
I'm gonna write
redeemed
that
yourself,
down.
madam. I am putting my pen away. Good job. Very good. Okay, sacroiliac joint. Okay, Miss Bloddick, what is this big thigh bone called?
The femur,
Yes! Oh, this is good. All right, what is your kneecap called?
The patella.
Yeah. What is your skinny lateral leg bone called?
Like the really small one.
Yeah. It's
The
lateral. It's
fibula.
fibula. What's the thick medial one called?
The tibia.
Yeah, the tibia is resting on a bone when it meets the foot. What's that bone?
And the patella.
Well, the patella's up here.
Oh my gosh. No.
You know this. You know this.
It's the talus.
Talus.
Sorry.
Yeah, you knew that. I know you know that. What's this bone up here called?
The humerus.
Yes. What is the bone running to my thumb called?
The ulna. No. Radius. And then the ulna goes to the pinky.
Yeah. All I go to the
Sorry.
pinky. And all it is what gives you my elbow. Your elbow is actually the tip of your ulna back here, just so everybody knows. Good job, madam. Pleasure talking to you. Thank you very much. Thank you. Miss Cooper.
Hey,
Hey, Miss Cooper. How you doing?
what's up, dog?
Good. Hey, Miss Cooper, how many cervical vertebrae do you have?
7.
Good. What's another name for C1?
Atlas.
Yeah, what's another name for C2?
Axis.
What's another name? Excellent, by the way. What's another name for C7?
Vertebra prominence.
Yeah. What is the vertebrae that is inferior to C7?
Is it T1?
It is. How many T's are there?
12.
Yep. What is the vertebrae that's inferior to T12?
L1?
Yes. How many L's are there?
5.
Yeah. What does L stand for?
Lumbar.
Yes. After L5, lower than L5, inferior to L5 is what bone?
Sacrum?
Yes. What is the joint, by the way, between L5 and the sacrum called?
Is that the sacroiliac?
No, that's the sacrum and the hips. This is the joint between L5 and the sacrum. Remember how we name joints?
Huh?
Remember how we name joints? We pretty much use the stuff where it's meeting to name them.
Yeah, so is it just like lumbar sacral joint or something?
Pretty close. How about L5S1?
Oh, okay, yeah.
All right. And by the way, the joint between L4 and L5 is L4, L5. Like whatever you're trying to describe between those two bones. This happens to be L5S1. Anyway,
Okay.
the sacrum is attached to the hips. What was that joint again that attaches the sacrum to the hips?
The sacroiliac joint?
You are correct. How many hip bones are there?
There's 6.
Yes, 3 on each side. What are their names?
The ilium, ischium, and pubis.
Bam. The pubis comes in front right here. What do we call this joint where it comes in front right here?
Wait, say it again.
This joint where the 2 pubic bones come together right here in front has a name.
Is that the pubic symphysis?
I'll take it. Pubic symphysis. And I like that you said symphony because it actually does mean coming together. Symphony is a whole bunch of people playing together. Yeah. Okay, pubic symphysis. Beautiful. Nicely done. Hey,
It
what's...
looks silly, but I'll turn it on. I have my hood of my jacket over my hair towel thing.
I like it. I think you're going to start a trend. What is your thigh bone called?
Your femur?
Yeah, what's your small lateral shin bone called?
Fibula?
Yes. What is your thick shin bone called?
Tibia?
Yeah. What is the tibia resting on down here when it meets the foot?
Placus? Talus?
Talus. Good job.
Talus?
What is this bone here called?
Is it the radius?
No, the bone I'm grabbing. The arm bone. Brachial bone.
Oof.
Don't make any jokes. Just say it.
the funny bone.
Yeah, it is funny bone. So what do you call it?
Humerus.
Yes. What is the bone running from here to my thumb called?
The radius.
What is the bone here going to my pinky and my elbow called?
The ulna.
Yeah. Very good. Okay, thank you, ma'am. Thank you. Thank you, thank you, thank you. Mr. Kandaris, sir.
Yes, sir.
Thank you, sir. How many cervical vertebrae do you have?
7.
I'm sorry, what?
7.
7. Good. What's C1 called?
Alice.
What's C2 called?
Axis.
What's C7 called?
The protuberance.
Vertebra prominence?
Prominence.
Cool, we'll take it. We'll take it. How many thoracic vertebrae are there?
12.
Why are they thoracic vertebrae? How do we know they're thoracic vertebrae? What makes them thoracic vertebrae?
Shape and location. In the middle back.
They're associated with a rib. Anything associated with a rib is a thoracic area, period, by the way. But the fact that those vertebrae are attached to a rib makes them thoracic vertebrae. But any area of your body with a rib is a thoracic area. Good. How many lumbar vertebrae are there?
5.
5. What is the joint between your last lumbar vertebrae and the sacrum called?
So, vertebral sacral joint.
What'd you say?
I said vertebral sacral joint. I know it's not right.
It's not right, but actually it was very good. I will give you that. I really actually like that. Vertebral sacral joint is not a bad thing. I might even be able to figure it out. But it's just L5S1.
Okay.
Yeah, you'll hear that a lot. That's why I'm bringing it up a lot. It's the last disc before you hit the sacrum. What is the joint between the sacrum and the hips called?
Sacral iliac joint.
Yes, sir, it is. Why do we care about that joint? What's such a big deal? People talk about that joint a lot. Why is that joint important? Like, what's going on there?
Movement of the hips.
Yeah? Yeah?
There's a connection of the spine to the hips.
Yeah. Connection of the entire upper body to the entire lower body happens at the SI joints.
So that's very important.
Yeah. It's just they assume there's a huge weight transfer there, right?
Mm-hmm.
Yeah. Okay. Let's talk about hips, sir. Let's talk about hips, sir. On these hips, there are 2 bumps in front and there are 2 bumps in back. What is this bump on top in front called?
ASIS.
Yes, and what is...
Anterior iliac superior spine.
Wait, say it again.
Anterior superior iliac spine.
Yes. What is the bump underneath it called?
It's the inferior. Wait, no. Anterior, inferior iliac spine.
Really good. What's the bump on top and back called?
Posterior superior iliac spine.
Yes, sir. Really well done. Let's leave it at that. Thank you, sir. Miss Hunter.
Oh my god. I'm so mad. Anyway.
You're mad?
No, okay, so I was like, I got it. And then I didn't hear everything about the ASIS and stuff. And now I'm like, no, why are you calling me? Anyway, it's okay.
It's all going downhill here. I can have Mr. Kandaris review the iliac spine stuff for you if you'd like.
Okay.
Yeah.
Well, no, I want to try it.
Oh, okay. I mean, you're going to try it either way, but I would.
Yeah.
Okay. All right. Well, let's do some basics first. How many cervical vertebrae are there?
7.
Yes. What's the name for C1?
Atlas.
Yes. What's the name for C2?
Axis.
Yes. What's the name for C7?
Vertebrae prominence.
Yes. What's the name for C8?
C8. The name for C8 is T1.
Yeah! Oh my God, that was awesome. Yeah, I was expecting like it doesn't exist, but T1 is even better answer than that. There is no C8. It has to be T1. Really good job. How many T's are there?
12.
Good. What is the name for T13?
L1.
L1. Thank you. How many L's are there? How many?
Was there a question?
Yeah, sorry. How many L's are there? How many lumbar vertebrae? are there?
5.
Good. What is the name for L6?
Is that the sacrum?
Yeah, it is. It is. I'm sorry. I was just taking our joke the whole way out. By the way, everybody, just so you know, some people do have an L6. Some people have this strange, I shouldn't say strange, I just called a whole bunch of people strange. There's nothing strange about it. But some people have a thin, like lumbar vertebrae are usually really, really big. But some people have a sixth one that's kind of small, and it's just down there. It's L6, and it's a thinner lumbar vertebrae. But most people, it's L1 through 5. Anyway, what do we call the joint between L5 and the sacrum?
Sacral iliac joint?
That's between the sacrum and the hips.
Oh.
That's on the sides, sacral iliac joint, sacrum and ilium. I'm talking about between L5 and the sacrum.
L5 in the sacrum? Lumbar sacral? I don't know if this was said. I can't remember this.
L5S1.
Oh, L5S1. Okay.
Yeah. Cool. All right, what are the 3 sacral bones? Oh, sorry. There is no such thing. What are the 3 hip bones?
Ilium, pubis, ischium.
Thank you. What do you call the joint in front where the 2 pubic bones meet?
Okay, I don't know, it froze a little bit, but it's pubic symphysis.
Beautiful.
Something.
Pubic symphysis. That was beautiful. You did freeze, but then you unfroze and you answered correctly. Pubic symphysis. Thank you very much. By the way, this is the joint, everybody, that relaxin, if you are a lady and you choose to have a baby, relaxin, that hormone in your body, actually softens up your soft tissue and actually loosens this joint up a little bit so your hips can open up so you can birth easier. Cool. Yeah, interesting fact. And I love that they call the hormone relaxin, because that literally is what it does. It relaxes soft tissue. Miss Hunter, I have 2 bumps on the front of my hip here and 2 bumps in the back. What is the front bump that's most on top called?
Anterior. Is it, you said on top?
Mm-hmm.
Anterior superior iliac spine.
Very good.
Right?
Anterior superior iliac spine.
Oh, okay.
That's beautiful. Nobody has been asked this next question, so if you don't get it right, it doesn't hurt you, okay?
Okay.
What muscle attaches to the anterior superior iliac spine, or as is?
You said what's the muscle?
Mm-hmm. There is a muscle that attaches to that bump. Yeah. But a little bit of a low
would I know it if it's...
Yeah, you know the name of it. You know, like, when I tell you, you'll be like, oh. Yeah.
Great. Can I look through the book? Hold on.
Can I give you a clue? Can I give you a clue?
Yes.
It's not in a group.
It's not in like, okay. Why don't I know any muscles in those hips?
Well, it's not just in the hip.
You said it's not a hip?
Well, it is, but I just meant it's you know, it's not just in the hip. That's just where it attaches. It goes to other places.
Oh, this is gonna drive me insane.
By the way, it attaches on the anterior superior iliac spine, and it inserts or attaches into Miss Monreal.
Oh, it's a leg thing. It's not a rectus femoris?
No, the rectus femoris, and I'm telling this to everybody because I will ask this question, the rectus femoris actually attaches to your anterior inferior iliac spine. This attaches above that, anterior superior iliac. Rectus femoris, though, attaches to your anterior inferior iliac spine. Yeah.
Is
Yeah.
it a sartorius?
It
I'm
is.
just
It is the sartorius. Yes, ma'am. Not in a group.
Oh, okay.
Not in a group. Part of the pes anserinus. Yep. Sartorius. Starts
Because
all
all
the way
I
up
can remember
there.
was the insertion there.
Yeah. Very good. Very good, ma'am. Very good. What do you call the bump that's on top and in back here?
Posterior. On top. Okay. Posterior superior iliac spine.
Yeah.
Those used to be.
We care about that bump not because of what attaches to it, everybody. We care about it because it's right by the SI joint. If I want to find your SI joint on your body and work with it, I come along from the side. I can find this bump on everybody. And if I curl my fingers right in here, I'm in the sacroiliac joint. The sacroiliac joint is right by the posterior superior iliac spine. That's how I find it. These dimples you see on the back of people, when you're working on them, that's probably the PSIS, posterior superior iliac spine. And if you dig in medially from that, you're right in the sacroiliac joint, which is really good to know because it's very hard to feel the sacroiliac joint. But that gets you right in that spot. That drives Miss Monreal crazy. Yeah. Cool. All right. Thank you so much, Miss Hunter. That was very good. I hope you're feeling good about it. I'm feeling good about it. Yeah. Miss Monreal, we've been talking about you.
Yes,
How you doing?
I'm doing aight.
You doing all right?
Actually, my sacrum is killing me. I loved what you did yesterday. It helped me so much. But now it's back with a vengeance.
Ooh.
You'll have to tell Miss Torres how to fix me.
Yeah.
Anyway, go ahead.
Yeah, I don't like that. That's terrible. So it's your SI joint that's bothering you?
Yes, but now it is on the opposite side.
Interesting. We got it to switch. So
Yes.
what does that tell us as massage therapists, by the way? I'm not sure there's a...
I've been trying to figure it out all morning.
So here's what it tells me. And I'm not positive I'm right. We're just discussing this like colleagues. What it tells me is that we're on to something correct. Like we're right that there's some tension around the SI joints. And when we manipulated the torque, we got it to actually take the pressure off that side and hurt the other side, which tells me that we're at least getting movement in there and that we're in the right realm of like what's wrong. It doesn't mean we've solved it yet, but does that make sense? Like we've got this thing to shift around, which means that manipulation of your hips really does have some effect. And the answer probably lies in there somewhere. That's what it tells me at this point.
Okay.
Miss Torres, you had your hand raised.
Yeah, it tells me that Martha's weird. That's what it's telling me.
Yeah?
Yeah, well, so are you. We're just the same, so
Yeah. It took you, I figured that out about you guys like 10 minutes into the first class.
Whatever.
I didn't need to work on your sacrum to figure that out. You guys are nuts.
Okay, thanks.
Nuts.
Okay, quiz me, sir.
Okay.
Because I'm in a place with good reception right now.
Yeah? Oh,
Yeah.
now's my chance. What is this?
Scapula.
Good. What is this?
Oh gosh, hold on. Okay, so I'm standing. Okay, so
Here, this might help you.
Can you put it the opposite way? Okay. So the medial border,
Thank you. What's this?
lateral border,
Yes. What's this?
inferior angle,
Yes. What's this?
superior angle,
Yes. What's this?
spine of the scapula,
Yes. What's this?
acromion process.
Yes. Spinal scapula turns into the acromion process. Good. What's this guy sticking out here?
Coracoid beak process.
Coracoid beak process. I love that because coracoid means beak-like. What is this? Which, by the way, receives this.
Glenohumeral fossa. No, something fossa. Glenoid fossa.
Glenoid fossa. And you're right. And by the way, some people call it the glenoid cavity, but it doesn't matter. It's the glenoid depression. And you're right. So what's this joint called?
Glenohumeral humeral joint.
Good, cool. What's this on top, this area on top here called?
Supraspinatus fossa?
Supraspinous fossa, we'll take it. Supraspinous fossa. What's this?
Supraspinous fossa.
What's this under here called?
Infraspinatus fossa?
Infraspinous fossa, yep.
Infraspinous fossa.
The muscle is called the infraspinatus, so you're really close.
Okay, right.
What is, get ready, flip over. What's this under here called?
Subscapularis fossa?
Subscapular fossa. And the subscapularis is in there. That's good.
This is like way from the beginning. Why are you doing this to me?
Because I don't like you very much.
Okay.
I thought we
Fine, I'll
I
take
thought
it.
we were
I'll
clear on where you and I stood. I mean, I think I've been very honest in this relationship. All right? So, I'm kidding. I just wanted to switch it up, and I think you like being challenged.
Yeah, I thought you were gonna ask me all the other stuff. I've been super paying attention.
I know. No, just
Okay.
okay. It gets worse. So what bone is this?
Humerus.
Yes. Okay. There is a big bump here and a little bump here. The big bump's lateral out here. What's this big bump called?
It is. Is it a tubercle?
Yes.
Okay. And so lateral humeral tubercle? I don't know.
It's a lot better than this one.
Oh, greater tubercle?
Greater tubercle, which makes this other one what?
Lesser tubercle.
Yes. I love that.
But how would you say it? Would you say so greater tubercle of the humerus?
Yes, you would. You're absolutely right.
Okay.
Because you're right, a tubercle could be almost anything, so you'd say the greater tubercle of the humerus if you were being really nitpicky, absolutely. We knew we were talking about the humerus, but you're absolutely right. We'd say greater tubercle of the humerus, lesser tubercle of the humerus. What's this groove between the two tubercles?
Like I know it's a groove. Is it glenoid something groove?
There are two names for it.
Okay, so glenoid humeral groove.
I didn't mean two words. I just meant there's two different things people call this groove.
Oh, okay.
One is the groove between the tubercles. Do you know how to say that?
The groove between the tubercles?
Yeah, do you know how to say that, though, in Latin?
Intratrabecular groove?
Yes!
Okay.
Interturbicular groove, the groove between the tubercles. Thank you. Some people also call this the bicipital groove
Bicipital groove. Okay.
because, gotta make sure I'm saying this right, because the short head of the bicep tendon goes through here.
Okay.
And actually, it can actually pop out here. That's good. Cool, cool, cool.
Okay.
Hey, what are these bumps on the side here, down here at the bottom here called?
I knew you were gonna ask me that because I get confused. Okay. They're condyles.
Cool, I'll take it.
Wait, but what's the difference between an epicondyle and a condyle?
I honestly don't know. Here's
Okay.
the way I perceive it. For one thing, by the way, just so you know, condyles are kind of like mountains. They really are. And a mountain, this whole thing to me is the condyle. The epicondyle is like the tip of the tippity-top mountain. And then the crest, where they talk about the crest of the condyle, that's just the side of the mountain sloping down. So epicondyle and condyle to me are the same. I think we're getting pretty nitpicky. But an epicondyle would be like the epicenter, the dead center of the condyle. But I just care about the condyle. The condyles, you can feel them. Right? We don't have to get too picky. Does that make sense?
Yes.
Okay, good. Okay, Miss Monreal, good job. I'll come back to you later.
Great, I'm excited.
I'm excited too. This has been very good. Yeah.
I wasn't excited, but okay.
Miss Monreal. Miss Nguyen,
Yes, sir.
I forgot about you this morning and I feel terrible, but
Oh.
I have not forgotten about you now.
Oh, yeah.
Miss Nguyen.
Yes.
Okay. What is this very first vertebrae called?
Amish.
Atlas, that's correct. Or C1, good. What's C2 called?
Tissue for what about and the figure I think in the axis.
Axis, you think right. Atlas, axis, really good job.
Yeah.
The hips.
Yep.
Miss Nguyen, the hips are made out of
Yeah.
3 bones. What are their names? What are the 3 hip bones?
Three hip bone. Sacrum. No.
Not the sacrum. The sacrum's in the middle of them. I know why you're saying that. But the sacrum's in the middle of them, but they come off the side. So the sacrum's here, but we're talking about the bones on the side here. They're made up of 3 bones that come together to make your hips.
That is the pelvis. No.
Yeah, they are. That's all considered the pelvis in a way. Here, hold on. Just getting a prop here. So, believe it or not, this hip here is actually created by a bone here, and a bone here. They come together to make your hips. What is this bone? What's this bone? What's this bone?
Oh, I think in the shack. I don't know.
So this is your sacrum.
Yeah.
Sacrum.
Yeah, right.
All right, this is your sacroiliac joint. So what's this bone here?
Oh, what the bone here? Super. Wait, one more minute.
Yeah, no, take your time, hon. It's okay.
Sacrum.
Here, I'm going to start you out, okay? This bone is the ilium. Ilium. So what's this bone in front here? Ilium.
So please tell me.
That's okay. Yeah, ilium,
Ilium,
pubis,
pubis,
and ischium.
ischium. Okay.
So what is this again?
Ischium.
No, this is ischium. What's
Yeah,
this?
ischium.
Ilium?
No, and the you say in the I don't know. And
Remember this
Ischium.
one? Yeah, this is your ischium back here in your butt. But this is your ilium. Say
ilium,
ilium, ischium,
Ilium,
pubis.
pupil. Okay, pupil.
Ilium,
Ilium,
ischium,
ischium,
pubis.
pupil. Okay.
One more time. Ilium,
Ilium,
ischium,
ischium,
pubis.
pupil.
Cool. I'm going to come back to you. Don't worry. No, I love you. I could never leave you for very long. Good. Okay. Hey, Miss Yanes, I know I already called on you, but Miss Yanes, what is the muscle that attaches to the anterior superior iliac spine?
The sartorius.
Yeah, and what's the muscle that attaches to the anterior inferior iliac spine?
The rectus femoris.
Yeah, and what is the really important joint that can be found by the posterior superior iliac spine? Take a guess, you'll know. You'll guess right if you guess. What is the joint found by the posterior superior iliac spine?
Is it the sacral iliac joint?
It is the sacroiliac joint. Good job. That's what we use it to find. Good job. Thank you. Thank you, thank you, thank you. Good stuff. Hey, Miss Felix Osuna.
Yes.
Miss Felix Osuna, what is the muscle that's attached to the anterior superior iliac spine?
The sartorius?
Yes. Where does the sartorius insert? It inserts into a weird sounding place.
The concerninus?
Pes anserinus. And I haven't asked this next part to anybody, so it's okay if you don't know. On what bone do we find the pes anserinus?
Could that be on I wanna say maybe on the lateral side of the femur?
Medial side of the tibia.
Okay.
Yeah, don't worry. Nobody, we didn't ask anybody yet. But everybody, just so you guys realize, the pes anserinus works because it's an attachment across the knee. You've got a hamstring muscle that attaches in there, the sartorius that attaches in there, and the gracilis. And they all attach on this medial spot on your tibia. You can rub it right now on yourself. It's a soft, sensitive spot on your tibia. That's the pes anserinus, where three muscles come together. One last question, Ms. Felix Osuna. What important joint can be found extremely close to the posterior superior iliac spine?
Was it the sacroiliac joints?
It is. Yes, ma'am. Thank you very much. Thank you.
Thank you.
Cool. Miss Hanson.
Yes.
How we doing?
We'll see.
Okay. We will see. Yes, we will.
I can't see that.
You can't see that? Oh, because it's too high? Because it's too high, is that what you said?
Yeah.
Yeah, I don't blame you. Thank you for telling me. Let's try that. Okay. Let's try this again. I think you see where I'm probably going with this. Hold on.
Mm-hmm.
Good. Yeah. And let's see, I gotta think about this for a second. Got 1, 2, 3. Got a big one here. Got a long one there. And a huge one down here. Okay. What is this right here?
Distal phalange number 2.
Yes. What is this right here?
Proximal phalange number 5.
Yep, you're exactly right. What's this?
Middle phalange number 3.
Yeah, really well done. Thank you, ma'am. Hey, what's this right here?
Metatarsal number 1.
Yep, you're exactly right. What is this?
Is that the what is that?
You're kind of, I feel like you're mixing two bones right now. These three have kind of the same name.
What?
These three have kind of the same name.
Yeah, something
Cuneiform?
cuneiform.
Yeah. So which cuneiform is this?
That's the lateral.
So is your big...
Is that the big toe? That's the medial.
Good. So that's a medial cuneiform. Yeah, cuneiform. What's this one?
That's the middle.
Middle what?
Cuneiform.
Cuneiform, I think is the way to say it.
Cuneiform.
Good, yeah. Hey, what's this bone out here?
Cuboid.
Yeah. What's this bone here?
Oh gosh, I don't remember. Hold on.
It's all right.
No, that's the navicular.
It is navicular. And what's the name for your heel bone?
Calcaneus.
Yeah, very cool. What is the name of the tendon that is shared by the soleus, the gastrocnemius, and the plantaris that inserts into your heel bone? I haven't asked anybody this yet, so no pressure.
Okay, say it again. Tendon.
Yeah, you got a very important tendon that inserts into your heel bone. It is it's a shared tendon of your calf muscles. It's your gastrocnemius, your soleus, and your plantaris.
I don't remember.
It's your calcaneal tendon.
Oh, calcaneal tendon.
Yeah. By the way, some people call it your Achilles tendon. That's the slang term for it, but it's your calcaneal tendon. Good. That's good. We're good. We're fine, man. That was good. Let me ask you a couple other questions since I got you on the hook right now. Let me, you did great on the foot, by the way. Great on the foot. What is this joint right down here called?
Your pubis symphysis.
Pubic symphysis. We'll take it. Thank you. What is this joint down here that attaches my hips to my sacrum called?
Your sacroiliac joint.
Sacroiliac joint. What is the bony landmark that'll help me find it on people?
Is it the posterior superior iliac crest?
Yeah. Posterior superior iliac spine.
Spine.
Which comes off the iliac crest, so I see why you said that. Good. That's what I want to know. Cool. Hey, what hip bone is this back here, kind of underneath your bottom?
The ischium.
Ischium. What prominent muscle group attaches almost entirely to that thing?
Your hamstrings.
Yeah, your hamstrings. 3 out of the 4 heads of your hamstrings attach to that thing. It's really, really important. That's how you pull yourself up. That's really good. There is a bump underneath your kneecap on your tibia. It's very important, actually. I have not mentioned this yet. I mean, I've mentioned it in the past, but I meant not today. There's this bump down here. Do you know what this bump is called on your tibia? You can feel it on yourself. It's below the kneecap. And it starts tibial T.
I don't know.
It's the it's okay. It's okay. It's the tibial tuberosity.
Tibial tuberosity.
I'm making a big deal out of this, everybody, because I'm getting ready to talk about the muscles that insert into it. Do you know what muscle group inserts into tibial tuberosity?
Is it near the pans-anseritis?
It is near the pes anseritis, but the tibial tuberosity is in front, pes anseritis on the medial side here.
Would it be your quads?
It is, all day long. That's why I'm bringing it up. It's very, very important. So, just for everybody's edification, if we're looking at the front of a leg, if this is your femur, and this is your tibia, and I guess your fibula, and this is your patella, all of your quads insert into your patella via the patellar tendon, and then your patella inserts into your tibial tuberosity via the patella ligament. This is how your quads get across your knee so that they can cause an extension. They insert into your tibial tuberosity via the patella and the patellar ligament, patella tendon. Yes, Miss Moore?
Can you move it up a little bit? Or is
Yeah.
that
I'm sorry. I'm sorry.
Oh, you're okay.
No, you're right. Thank you. So all those quads come down, grab onto the patella via what they call the patellar tendon, because tendons attach muscle to bone, and then the patella is attached to your tibial tuberosity via the patellar ligament, and that's what attaches your quads down in there. That's a very important insertion, right? Does that make sense, Miss Hanson? Your face does not have the like.
Yeah.
Okay. What? It does?
Yes, I think it makes sense.
Okay, good. All right, cool. All right, let's take a break. This is a lot of tension. You're like wondering if I'm going to call on you, wondering what I'm going to call on you, all that kind of stuff. Let's take a little break here. All right, everybody. Just 45 minutes left of class. I think we're off to a really good start. I really do. Miss Nguyen, are you there?
Yeah, I am here.
Mr. Yen, what are the 3 hip bones?
We have both, ischium, ischium,
Ilium, ischium, ilium,
ischium, and pubis.
pubis. Good. Good job. Thank you, ma'am. All right. Miss Petrie. Yes. Miss Petrie. Miss Petrie, I don't even know where to start.
Okay.
Let's do some basics first, okay?
Okay.
All right. So let's do like, what is your brachial bone called here?
The humerus.
Yes. What is this bone that runs to your thumb called?
Radius.
Yep. What's the one that runs to your pinky and your elbow called?
Ulna.
Good, good, good. What's your collarbone called here?
The collarbone.
Yeah.
Called the collarbone.
It is called the collarbone, but some people call it a fancy name.
Oh, it's the
You know.
clavicle.
Yeah, clavicle. Good job.
Clavicle.
By the way, everybody, and Miss Petrie, of course, I respect how hard it is for somebody to grab out of the last 6 months random things and ask you about them. Like, you knew what a clavicle was, but you just were like, that's the last thing I was expecting, right? Hey, what's this joint called right here between the sternum and the clavicle?
Is it the sternoclavicular joint?
It is the sternoclavicular joint, and that is the joint that attaches your entire shoulders onto your body. It's the only joint that does that. Everything else is free-floating back there. It's kind of interesting. Hey, what's this joint called?
Is called the glenoid joint.
What'd you just say? Say it again. I think you're right.
Glenoid joint.
Glenohumeral joint. Yeah, good job. Cool, cool, cool. Hey, do you know what this little bump is called down here at the bottom of the rib cage?
Xiphoid.
It is. Good job. Xiphoid process. I love that. Okay. What is the bump in front of the hips here on top called?
Okay, so that would be the anterior superior iliac spine.
Beautiful. What muscle attaches to it?
It's the what muscle attaches to it is the sartorius.
Yes. It goes diagonal, goes down here into the leg, and inserts in this place on the tibia that's called the what?
Pananserinus.
Yes, pes anserinus. Inserts here with 2 other muscles. Good job. Cool, cool, cool. What is this bump below that bump called?
That would be the inferior superior iliac spine.
Think about what you just said.
The one below it would be the inferior. But anterior, inferior iliac spine. Sorry.
Ah, that makes sense. Before you said the up-down iliac spine.
Right.
But now you're saying the front-down iliac spine. That makes
Yeah.
sense. Be cool. What muscle attaches to that?
That is the, hold on, I know this. Rectus femoris,
Yeah, the rectus femoris is part of what muscle group?
part of the quads.
Yes, all of the quads insert where?
All of them insert into the patella and go into the tibial tuberosity.
Yeah, Miss Petrie, that was damn good. Thank you. Because what I really liked about it was you put it in your own words. That is what they do. They insert into the kneecap and then they insert into the tibial tuberosity. Really well done. Really like that. Thank you. Because of that, what main action do the quads create?
Flexion? No. Quads create.
Remember, the knee is the one thing that doesn't do what you think it's going to do when it comes to
Right.
flexions and extensions. Remember when you go to the gym and you sit in that little
So
chair?
I'm gonna say it's an extension then.
Extension of.
knee.
Yep.
The quads do an extension at the knee.
Yep, that's excellent. That's exactly what they do. And you do leg extensions when they're at the gym, right? When you're sitting in one of those chairs?
Yeah.
Yep, cool. Hey, I have not asked this yet, so no pressure, but what is your knee joint called?
The knee joint.
Yeah, we don't say it very often in this class. That's why it's not really, but it's important to know.
Okay.
Where the
so
tibia
that would
and the
be
femur come together.
The knee joint and the femur come together.
Where the tibia and the femur come together.
Tibial femoral joint.
Yeah, good job. Tibiofemoral joint. Cool. Yeah. Cool. Hey, the patella, your kneecap, is a certain kind of bone. I haven't asked this question either. These are just lots of random facts. It's a certain type of bone because it's wrapped in tendon and ligament. Do you know what that type of bone is called? You've got 10 of them in your body. Starts with an S.
Yeah.
This one's tough. Yes!
I'm about to say sarcomere, but that's not right.
But sesamoid is really close to sarcomere.
Sesamoid.
We'll take it. I love that. Yeah, that was good. Really good. Sesamoid bone. Okay. So a couple really last quick questions. How many cervical vertebrae do you have?
Cervical is 7.
Yeah. How many thoracic?
Thoracic is 12.
How many lumbar?
5.
What is the joint between your last lumbar vertebrae and your sacrum called?
It would be S1L5.
Yeah, most people say L5, S1, but there's nothing wrong with saying S1, L5. You are 100% correct. Thank you so much. Hold on one second. Ms. Hanson, you have your hand raised.
What was the question you asked her about the sesamoid joint?
Sesamoid bone. It's just called a sesamoid bone. So,
Is that what the kneecap is?
kneecap is a sesamoid bone. It's this bone that's kind of floating and it's wrapped up in tendon and ligament. So let me draw a little picture for you because this is kind of a geeky massage therapist thing. If we have that's a terrible. All right, that's a femur. This is your femur. Okay? And this big thick bone down here is your tibia. And on the lateral side, you've got a little cute, adorable fibula. Your kneecap, your knee joint is basically formed at your tibial femoral joint. This is what Miss Petrie was just telling us. This is your knee joint. And right here is the patella. It's actually pretty big. It keeps your femur from slipping out over your leg, by the way. It kind of saves your life a lot. So that's that guy right there. All your quads, I mean, you've got quads on vastus lateralis, vastus intermedius, vastus medialis, and rectus femoris coming down here. They all go in here, and they all insert down here in the tibial tuberosity. Really, it's just a tendon going all the way down the tibial tuberosity with a patella stuck in it. The patella is actually completely wrapped up in this tendon coming down here. Now, we call this portion down here a ligament because it is attaching the bone to bone. And we call this portion up here tendon because it's attaching the muscle to the bone. But really, this is all just the quad tendon going into the tibia, tibial tuberosity, and this patella bone is actually completely wrapped inside it. And stuff that's completely wrapped in a bone like that is called a sesamoid bone. You've got 10 of them on your body at high tension areas. The kneecaps are the biggest ones. There's actually 2 on the bottom of your foot by your big toe, and there's 2 by your thumb that are very tiny. These sesamoid bones are like little peas, but they're because of high tension. Miss Monreal.
Is that what it's called, a quad tendon? What is the name of the tendon?
No, they call it the patellar tendon. I mean, I think quadriceps femoris tendon would work. I think people would understand what you're talking about. I don't think it'd be wrong. But they call it the patellar tendon above and the patellar ligament below.
Oh, okay. But it's all connected.
It's the same exact fascia. You couldn't tell. If you and I were hacking into somebody's leg in some creepy, morose thing that we do out there in Faraday Valley at night. I don't know what you crazy people do on your estates.
That's what we do.
On your estates, you probably do. Anyway, we wouldn't be able to tell the difference. We just see this white stuff coming off the quads going into the leg, and we notice there's a bone in there. But some guy that named stuff came along and said, well, if it attaches bone to bone, then it's a ligament. And if it attaches muscle to bone, it's a tendon. But tendons and ligaments are the same fascia. Exact same fascia. So yeah, it's all just going in there. Does that help?
Yes, but seeing as I haven't dissected a body, is that
Yeah.
kind of what it is all the way through? Kind of like everything's just kind of meshed together? Or can you see separations?
I will play along with your haven't dissected a body thing, okay? Because I know we're on film. I get it.
Oh, you're good. You're good.
I haven't dissected a body either. Sometimes people just disappear. Yeah.
You're so hilarious.
Um,
It's okay.
She
Yes.
didn't say she hasn't dug a hole.
Yeah. Yeah, Miss Monreal, yes, that's the real truth. In the human body, that's the real truth is, and actually, obviously none of us should dissect a body. That's not a good idea. But you guys, if you ever get a chance, for those of you who are, and I'm not being snotty here, for those of you that are meat eaters still, butcher an animal sometime. You know, you don't actually have to kill it, but butcher it after it's been killed. Like, it's very interesting to see the way the muscles and tendons and ligaments, they're all kind of woven together, and you can separate them out, and you'll be like, oh, that's a pectoralis, that's a hamstring. You'll be able to tell stuff, but it's not like in the muscle charts at all. You'll be like, oh, it's very hard to tell, this is kind of glued to this other thing, and they kind of weave together, and yes, it's more like it's all one big fabric, with layers and gentle separations, but not parts that you can just remove. You have to cut everything apart, yeah.
I have a sister who performs autopsies, and she's offered me several times, like, well, do you want to come in and look at the muscles? And I'm like, nah, I'm good. But I'm really tempted to do it. I'm so squeamish.
Yeah.
But I really am fascinated by it, so I might just do it.
Just ask her if you can walk out, because when we go to the cadaver labs, when we used to, I would note the students who thought they weren't going to be squeamish were, and the ones who thought they weren't. It always shock you. And by the way, it is super helpful to your massage. And I don't mean super helpful in naming the muscles. Like what we're doing right now is super helpful. You will sound like a massage therapist when we're done. But getting to peel back the skin and see the thing that you've been touching, because you got to understand, you guys have been working through this, not a towel, skin, right? If you're lucky, it's been this. Usually, even on a slender person, it could be lots of this. And I've been telling you, hey, there's this stuff under here, and it's got, you know, in this case, I could be like, it's got 5 things sticking out of it and whatever. It's a lot different to see this and be like, oh my gosh, that's exactly what it is. And how interwoven it is with other stuff. It'll make you realize why it's so hard to find stuff in the body, because you'll be like, oh, it's all kind of woven in. Anyway, it's very worth it. It really helps inform like how you work with tissue. It's very helpful. And if it gets too much, you just walk right out. But since you have
that we don't get to go.
Yeah, I am bummed too. If it changes, which it might, we will go as a field trip towards the end of class, next class. But Miss Monreal, since you have a sister who does autopsies, what a coincidence, you can go check that out yourself. Yeah. Very cool. Anything else, Miss Monreal?
No, that's all.
Yeah, that's cool. Very cool.
I might give myself away.
Yes, you might. You might. Yeah. You don't notice the subtle connections between stuff if you're dissecting the body with a chainsaw, Miss Monreal. You gotta take your time. Okay. Okay. Miss Petrie, good job. Good job. I'm gonna move on. Don't make that face. That was a good job. Didn't you think it was a good job?
No, it was fine.
Oh, good. Okay. I was like, don't second guess yourself. Miss Stanley.
No.
Miss Stanley, can you please name the 406 bones of the body?
I can try, but I ain't getting it.
I can't do that either. Okay, Miss Stanley, let's see how many things we can name. How many cervical vertebrae are there?
Cervical vertebrae there is 7.
How many thoracic vertebrae are there?
12.
Why are they called thoracic vertebrae?
Why are they called thoracic?
Yeah.
Because they're in the thoracic region?
Why is it the thoracic region?
I swear I never heard you talk about that.
They are associated with a rib. What makes them thoracic is they are associated with a rib. Your thoracic region is anything with a rib in it, anything associated with a rib. So the thoracic vertebrae.
It doesn't even come by the name of like coastal or anything.
Yeah, I hear you, but that's why they're thoracic vertebrae. So let's talk about the ribs, you and I. What's the name of the first 7 ribs?
The true ribs?
Yes. What's the name of the next 3 ribs, 8, 9, and 10?
They're the false ribs.
Why are they false?
Because they don't attach to the sternum.
They don't attach to the sternum? That sounds
It's
like
hard to see because they're clear.
that sounds like 11 and 12. 11 and 12 don't attach to the sternum. What's 11 and 12 called?
They're the floating ribs.
Okay. So what makes 8, 9, and 10 false? They're not floating, they're not true.
Trying to live.
They attach to the sternum, but they attach to the sternum via the cartilage of the 7th rib. They don't use their own cartilage, they piggyback on the cartilage of the 7th rib. That's what makes them false. They're still connected, but they're connected by connecting to somebody else's connection. So the 7th, 1, 2, 3, 4, 5, 6, 7. The 7th one is the last one that directly connects in. 8th rib actually goes into the 7th connection. 9th rib actually goes into the 8th connection into the 7th. 10th rib actually goes into the 9th and the 8th and 7th. So 8, 9, and 10 actually go into 7 to connect in. So they're called false ribs. Good. Cool, man. Hey, what's this little pointy thing down here called?
The xiphoid process?
It sure is. It sure is. Really, really good. What are the 3 bones that make up your hips?
The ischium, the pubis, and the ilium.
Yes. What is the joint in front between the 2 pubic bones called?
Pubis symphysis?
Yes. What is the joint between the back hip bones and the sacrum called?
Sacroiliac joint?
Yes. What is the bony landmark that helps me find the sacroiliac joint?
The posterior superior iliac spine?
Yes. Cool. This back, this is hard to see from here. Hold on, let's give you something better. This is the front of hips, right? This is the back. You just told me about this bump here called the posterior superior iliac spine. This is the ischium right here. What major muscle group grabs onto the ischium back here?
The hamstrings.
Thank you. This is my cancel. This is my anterior superior iliac spine, my as is. What muscle attaches to here?
The sartorius?
Yes. And where does it insert?
Into the... I'm thinking...
I know. I just forget what it's.
It's hard. This is hard.
Because it crosses, it also, like, does it stop before the knee or does it just cross over the knee?
It crosses over the knee. That's very important. Otherwise, it couldn't
Yes,
affect the knee.
so. Okay, so it crosses over the knee, so I'm trying to remember the name of that thing.
The Miss Monreal.
The Pezanteres.
There you go. Pezantherinus. Pezantherinus, which is found on the medial proximal.
Medial side of the tibia?
Yeah, medial proximal tibia. Yeah, well done. Good. What muscle inserts into the anterior inferior iliac spine?
Not the rectus femoris.
It is the rectus femoris. The rectus femoris is part of what muscle group?
It is part of the quads.
It is.
Or no, the hand. Yeah, it is the quads.
Yes, it's the quads. Where do all the quads insert?
Let me think. Hang on, I know this.
Take your time. Take your time, man.
Wait. It's the tendon that has to do with the patella.
You don't have to tell it to me, like, if you can explain it to me, it doesn't have to even be perfect. I just want to know, like, where does it go?
It's like on the.
Like, what bone? What bone does it end up in?
Wouldn't that be the patella?
Okay. So they insert into the patella. I'll give you that. Where does the patella insert?
But it's over both the femur and the tibia. Patellar tendon.
They do. They insert into the patella via the patellar tendon. So the muscles come down, turn into a tendon, and insert into the kneecap. Good. Then the kneecap inserts where? Because you don't want to just have a kneecap hanging around.
It inserts to the.
You want help?
Yes and no.
Understood. I got that. It inserts into the tibia, into the tibial tuberosity, which is the bump. We can all feel it, everybody, by the way. It's this bump on the front of my shin below my kneecap. There's a pretty prominent bump there. I mean, from a massage therapist point of view, it's pretty prominent. And that's where the kneecap inserts, the tibial tuberosity. Tibial tuberosity, that's where all the quads go to.
Get me.
I know. It's tough. It's all right. It's okay.
I don't like the tuberosities, I'm just saying.
Yeah, I don't blame you. Yeah, I heard them talking the other day, and I don't want to be rude, but they were not saying nice things about you either. Yeah.
It's fine, they started it though.
I know they did. I was like, don't be like that. Anyway, whatever. They're a bunch of boneheads, so it doesn't matter. Okay. Thank you, Miss Stanley. Good job. Miss Harper.
Yes, sir.
I think you might be the only person I haven't called on yet. Yeah. We saved the hardest questions for last, Miss Harper.
No.
Do you like to be challenged, especially in public?
No.
So let's go through some stuff. Miss Harper?
Yes, sir.
Okay, ma'am. Let's see what we got here. Let's see what we can do. Can you see the skeleton and stuff?
Yes, sir.
Okay. You're so nice to me, Miss Harper. All right. Miss Harper, what What is this number one first vertebrae here called?
That's the C1, that's the Atlas.
Atlas C1. What's the next one called?
That's the C2, the Axis.
Yes. What's the seventh vertebrae called?
That's the C7, the vertebrae prominence.
Yes. What would be the eighth vertebrae down here called?
That's the T1, the
Yeah.
thoracic vertebrae.
Yeah, how many T's do I have?
12,
Good. What's after T12?
L1. the
Good. How many
lower.
L's do I have?
5.
Yes. This is a vertebrae. What are these guys called? Sticking out the back.
It's not the spinous process, right?
It's not the spinous process?
That's it? The spinous process?
I think you're right. Spinous process. What are these things sticking out to the side called?
That's the transverse process.
Yeah, very good. Very good. Thank you. What comes after, what's the bone below L5?
It's the sacrum.
What's the joint, you were correct, what's the joint between L5 and the sacrum called?
L5S1.
Yes! L5S1. What's the joint between the sacrum and the hips called?
The sacroiliac joint.
Yes, sacroiliac joint. What bony landmark helps me find the sacroiliac joint?
The posterior superior iliac spine.
Yes! What three bones make up the hips?
The ilium, ischium, and pubis.
Ilium, ischium, and pubis. Yes! What do you call the joint between the two pubic bones in front here?
The pubic symphysis.
Yes! What major muscle group grabs onto the ischium back here?
The major, that's the back, right? So that's the rectus femoris.
In back. In back.
That's the hamstring.
Hamstrings. Good job. You're doing great. What do you call this bump on the iliac crest in front and on top of another bump?
At the top, anterior superior iliac spine.
Yes. What muscle attaches there?
That's the sartorius.
Yes. Where does the sartorius insert?
It insert to the knee, the pens anserinus.
Pens anserinus found on what bone?
Tibia.
Tibia. On which side of the tibia?
In tuberosity. Tibia.
No.
The
Medial side. Because remember, the sartorius goes diagonal, so it's going diagonal. It's going to get to the medial side down here. Good. Good. What's this bump underneath that bump called up here in front?
The front, anterior, inferior iliac.
Good. What muscle attaches to that?
That's the rectus femoris.
Yes. What muscle group is it part of?
Quads. It's a part of quads.
Yeah, quads. Where do the quads insert?
The quad insert to the patellar ligament to the tibial tuberosity.
We'll take it. Ultimately, they get down to the tibial tuberosity on the tibia, which is why they can. You said it right. You're fine. I'm just shortening it. Which is why we can do a leg extension with them. That's awesome. Hey, what is this? What's your thigh bone called over here?
That's the femur.
Femur. What's this thick medial bone in your leg called?
That's the tibia.
What's the thin lateral leg called?
That's the fibula.
Yeah. What's the bone that the tibia sits down on here in your ankle?
That's the talus.
Yeah. What's your heel bone called?
Calcaneus.
Yeah.
Or Achilles.
What is the bone on the tip of your big toe called?
The bone of the big toe, that's the hallucis.
Well, yeah, hallucis is anything that goes to there, but what do we call the bone that's at the tip of my big toe?
The bone?
Yeah.
The tip of your big toe?
Yeah.
Phalanges. The distal phalanges.
Distal phalange.
Number 1.
Thank you. Thank you. Very, very, very good. Couple more questions. What is this bone here in the brachial region called?
Femur.
Yep, humerus. What is the bone going to? What's the bone going to my thumb called?
The radius.
Yes. What's the one that makes my elbow and goes to my pinky called?
The ulna.
Yes. How many ribs do I have?
12.
Yeah. What are the first 7 called?
That's the true ribs.
Yes. What are the next 3 called?
That's the false ribs.
Yes. What are 11 and 12 called?
Floating ribs.
Yeah. Why are they called floating ribs?
Because they don't attach to the sternum.
Yeah, they don't attach to the sternum. Very well said. Cool. What type of a bone is your kneecap, your patella?
It's a sesamoid bone.
Sesamoid bone. Yeah. Cool. Let's stop right there, Miss Harper. In some ways, by the way, Miss Harper, you had the hardest thing of it all, right? Because I was asking you questions already asked, which means, you know, you could have missed 35 points then. You could fail the class today, but you didn't. You would have never failed the class. You did really good. Thank you. You pretty much summed up everything we talked about. I really appreciate it, and I'm sorry for picking on you. It's really all fun and games.
You're good, sir.
You should be very proud of yourself, though. All of you should. That went really well, and I felt like you guys were paying attention. I felt like it was good. It made me very happy. Okay. Let's stop right there. Boom.